So we're going live. So Ken, we'll have you up. It's going to be amazing. We're going to do some banter. But yeah, we are here for it. So everybody, welcome to our Veterans Day observed edition of the Health Tech Talk Show. Oh my gosh, here we are. Amazing.
Veterans Day
Welcome.
observed, which is not actually a holiday. FYI, the post office is still delivering. That's how I know they are not actually doing it today, but we're doing it today.
Well, God bless our veterans. Thank you all for your service, serving our great country. We didn't even have to do.
Hello.
Oh, sorry. I just had the LinkedIn Live kind of go on twice there. It was fine. I was having technical difficulties.
Hello.
But it's fine now. It works now. But yeah, so we have an incredible lineup. We didn't even have to change graphics for our Veterans Day special because we already have America all over our talk show pretty much 24/7. So we have a cool lineup of Lisa ranting about companies that have shut down. I'm not allowed to rant about the one that I want to talk about, but it's fine. There's plenty. And then we have a U.S. Air Force veteran, Ken Allgood, who's going to talk to us about his company and honestly, whatever he wants. We did not prep as usual, so we don't know what's going to happen. We have Soleimeh, who's going to tell us about, we're actually not sure as well, but probably her conference that's next week. It's very exciting. She's joining in and beaming us from a mindfulness retreat, which we feel bad about. And then we have special correspondents who go to interesting events, Nadine and Melissa, to tell us about the Commonwealth annual summit. So it was probably good. I was there. I think it was fine. So anyway, Lisa, you take it away with news of the week. Do you want to talk? I made you. I stole you a special image right here.
Amazing. Startup graveyard. Okay. It's not nice. It's not nice to laugh about failed companies. That's not what we're doing here. But I do think that some of the people who fund these companies should be looking at themselves in the mirror and asking, why do I give all my money primarily to men who have no experience in the actual working world? Just a thought. I mean,
do you think it's more like
saying, why do I do this? Why?
Well, yeah, they should. But do you think also it's like me buying all that Bitcoin? Like I just got caught up. Yeah. Like I just got caught up. I bought all the Bitcoin, and then it's not. It's just it wasn't.
It's just the thing that bothers me so much is like, I bet if I went out there and tried to raise money, right, I have to provide so much information and be so certain about my hypothesis and have like customers signed and like ready to go. And then there are things that are being funded that have like basically no scaffolding and nothing behind them. And like, okay, when things get tight, right, you need to pivot and move your business and say, okay, we're not going to just like fund growth without any revenue behind it. We have to like actually adapt to the environment and actually solve problems for real customers in healthcare broadly. Let's just say if we're talking about healthcare. And some people can do that and some people can't. And if they were only building everything based off of just like a free flow of money and they never thought about how we're going to actually do stuff for real people and how to actually make it work, make the numbers work, then you're going to have problems. And so here we are. Big company shutting down who had a ton of money. I think Olive had $800 million. That's a lot of money.
They had more
right?
than me. Like, they had more than me.
Yeah,
they had more money than
you.
me.
They had more than you. And I think, I mean, there are a lot of people dancing on the grave of Olive, which is not very nice. But at the same time, it's a lot of money that turned into basically nothing, into less than nothing. And that's brutal, right? Think of what could you do with $800 million to help people in actual health outcomes, right? Like what would $800 million buy in terms of public health, for example? And I know like they weren't going to give that money to public health anyway. I get it. But it's like, you got to think about where it went and whose pockets it is in. They were not going to give it to public health. So it's a bummer, especially because we still have all this stuff that is not getting funded, and people who have great ideas and who are good at what they do and really want to accelerate it. And so there's a couple things. There was the Olive AI and sort of the background and all of the just analysis about that and why it happened. And there's the question of like, hey, does everything in health tech need VC money? Does it all need to be accelerated to the moon? And I would say maybe no. I mean, maybe in a minute Ken's going to tell us otherwise, like from his perspective as a founder.
Maybe Ken's going to be like, no, you need all the dollars.
No.
All the venture capitalists need all the board seats. I don't know what he's going to say. Because we have him prepped. We have no idea what he's going to tell us. He could tell us we're full of shit. I don't know.
Yeah.
We have no idea. But Avail medical systems shut down abruptly. Apparently only their CEO and their CFO knew, and they closed the doors at 5:00. Boop. Done.
And we're done.
And that company raised a shit ton of money too. That was, they were doing like actual telehealth equipment. So that's just like, whoop, out the door we go. But yeah, you and I were talking a lot about this. Like, do a lot of these companies even need capital? Like what? I run a consulting firm and people ask me all the time if I've taken investment. And I'm like, why would we?
For what?
Why? Yeah, like so I can fund the home office network.
I think it's for the graphic design budget. They want to know if you've taken money to really scale up the graphic design budget. The answer is no, but that's nepotism because it is your sibling who is the amazing graphic designer, and so you can just work
shout
out
out to Max Kowalczyk. They're the only reason that we have any sort of semi-legit stuff going on here, so that's fine. Okay, so but I do want to talk about Olive.
I want to read something out on Olive.
Read it.
All right. His talk is I don't know, it's like a messaging board from like the 1980s. Sorry, you guys are amazing.
It's like the hot sheets.
Commentary.
It's the hot sheets.
Hot sheet. Commentary, amazing. Delivery mechanism from 1987. But I love you guys, and your commentary is amazing. Just like the way it looks is like I am on a messaging board from a long time ago.
Yeah.
But they had a really they talked about like was Olive a scam, and if so, who are the victims? And their summary was like, no, because these people like had enough information to know what was going on. They made decisions or didn't make decisions like as they came, and whatever. And also they said those who don't know the history of, they said health IT, but we'll call it health tech. We decided to rename it. And thus are doomed to repeat it, should note these lessons. I think first of all, they said perform due diligence. That's a number one, like, hello, you are an investor. Have you heard of due diligence? Don't just give your money randomly, openly, and expect amazing returns. Do your due diligence. Customers should contractually obligate their vendors to meet whatever results and metrics led them to buy in the first place. Hey, that's a big question. Are you going to sign up with this new health tech company? What do you know about them? Have you validated the claims that they make? That's also on you when you're acquiring technology or working with a health tech company. AI, they laughed about AI. They were like, okay, guys, like back in the day, this was like...
What is AI? Like, what even is it? I don't know.
AI is the pets.com of the 2020s, right? Like, it's just like, come on, guys. Like, it's still just like selling pet stuff. And then lots of hype can be generated by sketchy companies, like, and like maybe do a little bit dig a little deeper. This one was good. Companies can be wheezing their last even as they pay big money for impressive exhibits and sponsored events at conferences. Kat, you're going to like that one.
What do you mean? I've never seen that happen. I've never even seen that happen.
That is a real one. That is like, just because they have a big like conference sort of like booth or like, city block in some cases doesn't mean that they actually are doing very well in the present day. And then they were saying like, if it's too hard to say, what does your company do in a sentence? Like, you should be concerned. And then the final one, which I thought was really good, was all companies and investors look smart when the economy is moving. This one's for you too, Kat, because you are waiting. You are waiting for the economy to crash so you can profit. And it's
still
great.
Waiting.
Like, everyone looks smart when the economy is going up, when things are going up. And so you can be like, we're successful.
You wait till I look smart. I'm going to look
we'll
smart
see.
pretty soon. 2024, the long cold winter. I think it's already here. I think we just have a lot of sweaters on. It's hard to tell.
No.
Okay, but I want to talk about Olive. I do want to ask. Okay, let's talk about Olive for real. Because when that story broke, who broke at Stat News? Did Stat News break it, or was it Axios? Was it Aaron Broadwin?
I think it was Aaron.
I don't remember.
I think Aaron called the scoop, but I'm not sure. No offense, Aaron. I don't think it was actually a scoop. There were a lot of people.
I don't think it was a scoop.
At the same time. Yeah.
I was like, it was like this freaking nuclear explosion, allegedly. But I was reading it and I was like, this sounds like at least 72% of all the health technology companies in our space lying, aggressive marketing, we didn't know what AI was at the time. So like it could have been a
Oh,
macro
it's
in a
AI.
spreadsheet. So like I was like, is this even a story? And then so I actually want, I mean, that story kind of
Is the
fucking tanked them,
macro.
right? Like it destroyed
Hmm.
them. So I don't really know if they, there's, this is shitty, but there's so many companies like that. Like I'm like, I just didn't think it was a story. I mean, it's a story because it was $800 million on the drain. Like that sucks.
That's
But
right. When you get to this
anyway.
stage where you were like considered a unicorn by someone for like your fake money valuation, and then you become no longer a unicorn, and they become no longer a company, like that's a big deal in the world of VC funding for health tech. But I also think like, did they make a real mark in the world? Did they make a dent in the universe? I'm going to say probably not.
I don't think so. I don't think so. But that's
Sorry.
fine. That's fine. Hold on. Do we have other exciting things to talk about before we transition? I don't remember what was on our list of things.
No, I mean,
Oh, what? Oh,
the news continues. Yes, Kat.
oh.
Other ideas, other things that happened. We're just sitting here on this pseudo holiday, kind of trying to fill time.
No, nothing happened. Nothing happened. No, but I have a quick announcement that I forgot to tell you about. Hold on. So,
Okay.
okay, before
Okay.
we transition into real guests, this is clearly a very sober picture of my good friend
Yes.
Dr. Ben
Wow. Yikes.
Zaniello and I. We are
Nice.
not drunk here at all, and here he is
No.
again. We hang out often in the airports. So I just want to say I am so proud of Dr. Ben Zaniello, MPH. He is the new chief medical officer of Best Buy Health as of this week. So shout out to Ben, looking so good. He's studying something here. I don't remember what it is. Comprehensive Review for Infectious Disease Board Prep. Cool. So that's Ben. We're very proud of him. Congratulations,
Yeah,
Ben.
he's
No
great.
idea what Best Buy Health does, but looking forward to finding out relatively soon. Amazing. Okay. All right. So let's go to our first actual guest, who is Ken Allgood, CEO of an amazing company, is here. Okay, sometimes we're not good at tech, Ken. So like sometimes I have to wait. I have to wait for the tech to show up. So I'm always a little worried it didn't happen. So welcome to our show.
Thank
Thank
you.
you for your
Yay.
service to our country. So just so everybody knows, we found Ken on Twitter.
Yes.
We were like, hey, we need.
Me. I
I'm
know Ken
sorry.
and
I
I
was
are
taking
Twitter friends.
credit.
We're Twitter pals. We're Twitter pals for years.
Okay, whatever.
Baltimore,
Absolutely.
Thank
DC
you,
area,
Lisa.
Twitter
DC.
pals.
Yes.
Okay.
Yeah,
Okay.
yeah, and we wanted to feature a veteran-owned business
Mhm.
in our space, and
Yep.
actually, I think multiple. Lisa, I know you found him, but multiple people did say we should talk to him. So
Oh,
Ooh,
obviously somebody in the
really?
fancy,
business
fancy.
space.
Oh,
Yeah,
that's good to know. That's good to know.
I mean, at least two others. So it's
At
basically
least.
you're
Well, there you
you're
go.
famous.
Oh my God. That's
Yeah.
amazing. Okay.
So
Well, that's good to hear. That's good to hear. So I guess, yes, I'm a veteran. I was in the Air Force for a while, was medically discharged, and then started consulting with DoD and shifted to work with DHA, Defense Health Agency, and VHA. Led that stuff with Deloitte, left there to go to a small SDV-USB, started working on stuff there, and then spun off and started our own consulting company, and then we spun the product out of that work that we've been doing with DoD and VA.
Nice.
So
Nice.
right on.
yeah, it's pretty good stuff actually. We've been engaged with community health centers, testing out components of the product, validating in the field,
Ooh,
and actually supporting delivery of healthcare in the field, like in tent cities and things like that. And we have it's an HIV support app. We took our patient app and we white labeled it for NAC to push it out underneath grant funded deployment there, supporting HIV support out in the field. I believe we have about 5 health centers that are going to take part in that pilot. And we're doing a little CDS
nice.
work
Cool.
down in Florida right now as well, using that component of the pilot. So we're actually
A
going
little CDS
for
work.
a little CDS work, a little clinical decision support around HIV, just a little bit, teeny bit.
Adjacent.
But
Adjacent.
doing it in Athena. So it's going to be nice once we deploy it there. We can make it available to community health centers all over the country or world using Athena 1. So good stuff there. And to the discussion around VC funds, we are actually going out for seed funds because we want
All
to
right. All right.
accelerate a little bit, hire some more people, and actually get out and start selling into the for-profit, nonprofit sector. So yeah.
Nice.
And to your
Very
question,
cool.
you don't need a ton of money. That's not necessary.
Yeah.
However,
See.
keep in mind the sales cycle here. You're talking anywhere from 12 to 24 months, depending on where you're selling into, how big the health system is, the operation is, and how big the board is, and who you have to convince there.
Uh-huh.
But you hit it on
Right.
the head. We are already paying our own bills. The product is doing that for
Right.
us. The product works. We've got excellent.
Wait, did you just wait? So you're not pre-product and you're not pre-revenue? What
That is
the
correct.
Amazing.
That is correct. And the beauty of it is right now, it's getting tough to get funding right now. So they're asking,
Really hard.
even some of
Yes.
the angels that we've been talking to, number one, do you actually have a real product? Does it actually work? Yes, we do. Do you have revenue coming in? Yes, we actually do. That is like step one now. It didn't used to be. It was all about growth before. And that's why you saw Olive and others get just tons of money because it was free money. Interest rates were nothing.
I
And
was
It's
so,
not
free
free
money.
though. It's not. I mean, it is free, but see that you were just saying about the boards, like
yeah,
when you take on investment like that, then those guys are hopefully gals, but most likely guys are going to be on your board and they're going to be asking you for stuff in theory, or they could be just like asleep at the wheel and not doing anything.
now
So
that's the
that's the
downside as
problem.
well. Now that's that trade-off you have to
Right.
come up with, and why it's so important to get.
Right.
If I'm going to take on investment, it's going to be with an organization that can help us do what we're intending to do,
Right.
which is continue our work with community health, and in parallel start to sell into for-profit and nonprofit organizations outside of the federally qualified health center arena. We want to continue that work. That's part of why we started the company. That's a big piece of our corporate ethos is impact where it's needed, and not the city block approach. Impact where it's needed, but also take into account that other people need this too. So make it available.
Yeah.
Mm-hmm.
Yeah. And because we don't replace EHRs, we sit on top of them and we bridge across them. We are basically, it's PCMH in a box. So patient-centered medical home is what we started out working on with DoD and VA. And we've taken that same patient-centric approach and brought it into primary care in general. So instead of having to hire a huge staff, instead of having to do all the triage, to pull all the records together, we automate tons of that on the back end. We also automate a lot of follow-ups based upon the care plans themselves. And we tie it into value-based care measures. So we're able to do that in the background and actually prompt the teams to do the right things and make sure that the rev cycle is addressed. We're not a rev cycle solution. I don't want to do that. Other people are already doing that super good. So
Yeah.
So clinically focused.
Yes.
Clinically focused, PCMA-based care.
Yes.
Awesome.
Empowering
Very
the
cool.
patient as well. So helping the team take better care of the patient. And again, there comes that value-based care, that set of measures that we're able to tie into as well, reducing the risk for the provider and their team. So
very
and
cool.
that
So right now your
FQHCs,
FQHCs.
right?
What's that? Yeah. So your FQHCs right now, so primarily Medicaid, I'm assuming. Are you targeting?
Yeah.
Yeah, we love Medicaid. High five. God bless you for paying attention to the underserved. So what you said, you're raising your seed round. You want to go out and you said you want to go after for-profit and some nonprofits. So and it sounds like maybe going after the commercial sector a little bit more, or line of business.
So I've got contacts because of the DoD and being on the East Coast. We have an advisor that's out on the West Coast. He's got good contacts out there. So believe one of the organizations we're going to be talking to in the next couple of months is Seattle Children's Cancer Hospital, as an example. So they have a need for this high touch outreach and to be able to connect the dots more effectively. That's what we're built to do. So
very cool.
Yeah,
freaking love it.
Great.
Amazing.
I would just like to point out that, again, like you already have a product, you already have revenue, you've already identified a way to solve problems for your actual constituents in the field right now, FQHCs, and you could see an expansion. So that's what I would hope people would want to put their money into versus the idea of putting a huge amount of money against, scale to to somehow magically create revenue in the future of something that isn't even created yet. I don't understand. I understand, right? I worked in growth marketing for a huge part of my career. Like I was there at the beginning of the bad stuff. And also, if you're going to put your money somewhere, you've got to have some kind of idea of like what you're doing. Can you actually deliver on it? Can you actually make any revenue? Is there a point to this? So
Yeah.
I hope that you will get some great investors for this round who are ones that you can also choose and say, is this investor someone who's going to bring something net new to us as well, right? There's a two-way relationship there, hopefully, which is also something
Oh,
that's failing
absolutely.
in many cases, right?
No,
Like,
it's critical.
who are
I
you
mean,
bringing
Yeah.
on? What do they want for that money?
well, precisely. And do they recognize that? Because that's the other thing about healthcare, right? Your average investor is looking for a 10 to 20% turnaround. And
Right.
realistically, in healthcare, as long as you're patient, can you achieve that? Yes, you can. But you have to be patient and not push to grow, 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 grow. Otherwise, you quickly outstrip your actual market and you become olive. So, and to your point, though, I'm lucky because I came up through, I was a lead architect
Right.
for DoD on what was supposed to be the Joint Electronic Health Record. So I've
Ooh, talk about
seen,
spicy.
we built all that stuff. Oh, politics, they're great. Um, but we designed things that were supposed to work. And so not everybody has had that experience. So yeah, our approach
Mm,
has been different. We
yeah.
bootstrapped from the start. And yeah, we haven't taken on a bunch of debt because I don't want to go down that path. I don't want to have a
Smart.
board
Right.
that tells me what to do that doesn't truly understand what
Yeah.
we're doing. So
That's right.
Perfect.
That's right.
Ooh,
Well, comment.
oh, go ahead.
Go ahead.
the
Listen, Ken,
comment,
like I told you, we're not so great at the technical, so sometimes we see
We're not.
comments, sometimes we don't. But
okay.
super fan. She might be our super fan. We might be her super fan. Alia Suleiman, who's like Lady Boss lawyer, she says, and you've already figured out EHR integration. Hand clap.
Yes, we
Clap.
have. I'm also the co-chair for BPM Plus Health under OMG, along with Ben Cushing from Red Hat. We lead the implementation piece there, and we've been engaged with HL7 for 5 years. So yeah.
Nice.
Yeah,
Nice.
Fantastic. You're like
we
you
understand
like do
standards.
stuff.
Well, and a standard doesn't solve everything. Fire ain't there yet, 100%, but it's a good start. It's implementable at least. So yeah.
Fire's not there.
Mm.
Fire's not there. Lisa, sorry, I interrupted you. You ask your very intelligent
No,
question. I'm
I
sure
was
it
just
is.
I was just saying in relevant news, maybe you saw the news yesterday that or day before yesterday that
Mhm.
the IHS EHR contract has been awarded to Oracle Cerner.
Yeah.
Shout out to Kurt from InterSystems for flagging that for me. But yeah, huh.
They didn't want that.
I
So
I don't
What do you think about that?
I
I
feel concerned.
mm, I have concerns too, being supporting DoD on their Cerner implementation. So I had heard from friends at IHS that they didn't want to go down this path and it was going to be super expensive.
It
So
will be super
when I saw
expensive.
that
And where are we
announcement,
with the Where are we with the joint EHR right now? Come on, what's the status update? Is there a status update? Lawsuit, like disaster, patient harm. Speaking of like our veterans, I
Oh,
know there's some
God
issues
bless our
there.
nation's military.
The
Cerner
veterans.
did a good size job, you know.
I
So
don't
Oh
know.
man.
There's so many morning, I read my little morning Politico emails. There's so many that are like, Cerner's screwed. Like, I don't even read them anymore. Like, I don't even read them anymore. So I don't even know what's going on there, you guys. I have no idea.
well,
Can't help you.
maybe Larry
It's just
Ellison's
complicated.
tons of money will fix it. Who knows? So,
Yeah.
Probably.
Maybe backing up a massive truck of cash will fix this problem. What do you think?
precisely.
Yes, no,
Precisely.
maybe? Just a
Yes, we need
huge,
more
just a
engineers, more monkeys engineering. That's all we need. So,
nice.
Yeah. I
We
don't know,
agree.
y'all. Well, can we have a conversation about the state of healthcare for our veterans here? I feel like Lisa has been posting about how she's gonna go nuts on this all week on the LinkedIn. Ken, what
excellent.
do you think? What do you think? What do you think?
As a person who actually is seen in the VA hospital, hence my medical discharge, so the care is in DC anyway. It's gotten
Oh
better.
yeah.
It's gotten so much better. There's a reason they haven't shifted to Cerner yet, simply because they understand the systems very well. Vista still functions. The GUI, the workflow, all that stuff really suits the way they deliver care. And even though they're starting with, or supposed to be jump starting with, the workflows that DoD built on Cerner and spent 2 years doing that, those are still not aligned with the way that they deliver care. So it's going to be a bit of a challenge. And I personally am glad to see them put the pause on and say, yeah, we want to get there. There are ways to get data in and out. We don't all have to go to Cerner at the same time. It's not critical. And you shouldn't until the workflows match the way you actually deliver care.
Too dangerous. It's too dangerous to risk people's care. You just, as annoying as it is, you're like, okay, let's get this project done. It's a freaking massive project with like really serious concerns. It's not just like we get to decide whatever. There's like laws, regulations, like people, like there's for a reason, right? It's not like oh, it's just a commercial thing. Why can't they get the EHR implemented? It's like we're talking about care for veterans, care for people in the military as well, who are needing, like, in some cases, very serious, complicated, coordinated care. You can't just be like, whatever, press the go live button. See you later.
And the VA is even more complex than DoD because DoD really has compartmentalized case management for anything other than medical care. The VA is all one big thing, and the case flows through Vista, and you can't tear that apart. So it's not just bringing in Cerner, it's also how are we going to make that work with all of our case management solutions, all the stuff we do around homeless populations and everything else, all the public health outreach and engagement there. How are we going to do that? That is not what Cerner is built to do, and Cerner actually doesn't do what they sold it to do. Not yet. It can, if you pay them enough. But
back up the truck of money. Keep going. More money.
Give it to me. Give it to me.
Money machine. Money. The wood chipper needs some money.
Billion. That's all we need. A few billion more. That's going to be great.
Oh my goodness. Oh my goodness. Well, all right. Ken, our super guest on our Veterans Day special, observed. Any parting words for us before we move over to Solomay and mental health, which is another good topic.
Yeah, exactly. And I can't wait to hear about that. Healthcare is baby steps. Don't give up. Keep pushing forward. That would be the only recommendation I have. So,
solid.
Incrementalism, one of our favorite topics.
Thank you.
Oh my gosh, thank you, Ken, and thank you for your service to our great country.
Indeed.
All right. So we got Solomay up next. Everybody knows her, I feel like. This is an amazing image of her that I think I stole off Instagram. It's an image of her with her image. So we are excited to have her. She's amazing. Solomay, you're going to have to introduce yourself because I feel like your resume is 4,000 pages long, but please introduce yourself and you let us know what we're talking about because as you know, we have not prepped.
It's ChatGPT wrote it. And also, thank you, Ken, for your service. Yes, that was so exciting to see that at Health. And they said I could take it home, and I forgot to follow up. Oh, my gosh.
Oh, no.
Probably sitting in a dumpster.
How would you have taken that home? What would you have done with it? Could you put that in, like, under the plane? I don't know.
Tack it onto a rental. I don't know. That thing was awesome. Yeah, when am I going to ever have that again? Oh my gosh. Highlight of mine.
Yeah, shout out to the geniuses at Health because they get everyone to take a picture next to their image and everyone loves it. You love it. You're like, look, it's me. So I wish you would have taken home.
True.
Amazing.
I've seen Lisa's selfie, so I know it's real.
Yep.
I know it's real. But yeah, so Solomay, tell us about yourself. You're joining us from a wellness retreat.
Which is amazing.
Feeling surprisingly zen.
Commitment.
For this 1,000+ person conference next week. Well, thank you so much for the invite. I am have always been involved in the mental health field, first and foremost as a patient. So I'm not a technologist, not a clinician, but really come at it from a lived experience perspective ever since having really bad anxiety and OCD as a teenager and not being able to find anything online. In 2006, when I was 16, I started a teen online resource and continued that nonprofit for 10 years. And so that's how I first got started into pursuing this path in mental health innovation, technology. And so what is next week is our annual Behavioral Health Tech Conference, but it's our first time doing it in person. So we
Yay.
started virtually in COVID. I think it was like March 2020. And I thought, there should be a virtual behavioral health conference. And we had a few thousand people at that, 2,500. Then the next year we had 4,000. Then last year we had 5,600 online. And now we're going fully in person. And yeah, super excited.
That's wild. Amazing. And tell us, you've done so much. I've heard you speak several times because you're everywhere. I think you told me you committed to over 40 speaking events this year. So
Oh
well
my
done.
God.
I'm glad you're at this wellness retreat and getting some rest. But you've done some other incredible things. I know you talk about how you started this little website and it became like your career, right? But you've been a scout. You've worked for all kinds of different orgs. So tell us a little bit about that background too, and then we'll dive into the conference.
Thanks. Yes. Yeah, the thread, whether large or small company, has always been behavioral health technology and access. So, yeah, out of college, I had my own mental health tech startup that started just as a little project in a business plan competition at the university, but eventually built the thing and partnered with partial day and residential programs for adolescents and adults. I ended up working at a large behavioral health EMR company. Speaking of EMRs, selling every kind of ancillary add-on for all kind of behavioral health provider types, IDD, foster care, addiction. Worked for a couple different early stage venture funds over the last 6-7 years now. But yeah, I'd say I have been off on my own for about 5 years. That was the beginning of the newsletter. I was consulting various organizations. One of them happened to be a Pivotal Ventures portfolio organization, which happens to be Melinda French Gates' personal office. And then also around the time of launching the first behavioral health tech conference during COVID, Pivotal reached out to me and said, would you be interested in running a youth mental health fund, a COVID response fund that would fund youth mental health CBOs, community-based organizations, nonprofits nationwide, that is especially focused on adolescents of color and LGBTQ teens.
Wow.
And so, of course, was so thrilled to have that opportunity, and we funded 100 youth mental health organizations nationwide
Wow.
through COVID. And now
Wow.
I'm the
That's
co-chair,
amazing.
creating the next
Yay.
one for the same community. Thank you so much. Yes.
That's so
Very
cool.
cool.
Talk about
Amazing.
being in, I mean, obviously not like a, not in any way or shape or form random chance. Like talk about building up and then being there ready to receive like a bunch of really amazing opportunities once people realize what you were doing. That's really incredible. I'm really
Right.
Thank you.
You
Thank you.
really
Yeah.
are everywhere though, and I don't know how you are. I mean, I'm interested to know if you have any tips for how you are maintaining your own sort of peace with so much promotion. I mean, there's a lot that you're doing, a lot of speaking engagements, that your own conference. I unfortunately know what it's like to do your own conference, and it is a lot of work. I just sending you best wishes from conference land, and that's a lot. It's a lot to do in a short time. Really amazing.
Yeah, I don't know how
Yeah.
it's like I manage my anxiety a little, and then somehow I need to sign myself up for something else, like planning a
Yeah.
conference. I don't know. Really.
Yeah. Well, you're freaking crushing it. So that's awesome. So and then shout out. I'll be there along with Nadine on my team, Brittany and Emma Nelson, who runs Zoria Foundation. So
Oh,
we're like bringing a pack. It's going to be amazing. We're going to do stuff. But so I want to ask you. So we've talked about like venture funding and like we trash talked a little bit here. But it seems like the behavioral health space is like there's a lot of attention there now, and there wasn't earlier. Right? It was tricky. It was hard. Like all kinds of scary things. But like, what's your perspective on that? Like having run this fund and like done some amazing things, and now, I mean, I know everyone's throwing money at you to sponsor your conference, right? Like 100%. Everybody, they're coming out of the woodwork, right? So, and if they aren't, maybe they should next year. But yeah, like, what's your perspective on all that?
Right. And thank you, Kat. That was the next thing I was going to say is thank you so much to the Zoraya Foundation for the
Oh,
scholarships to the women that can attend the conference now. That is just hugely
Yay!
important. So I'm really grateful that we could do that together. We have quite a few that are attending our Maternal Mental Health Equity Summit at the conference that are grantees of that support. So thank you so much. But onto your question, yeah, I'd say in a nutshell, of course, COVID accelerated funding, investment in the mental health and addiction space so much, and which makes a lot of sense because the demand has increased so much for the services,
So
and
much.
yet our workforce is just too small and shrinking. Providers are burnt out from the pandemic, and those effects are going to be ongoing even if the pandemic has calmed down. That burnout, that takes years. And so,
Right.
for me, and I think what a lot of investors see a possibility in is for mental health addiction technology to be able to extend the existing
right.
workforce
Mm-hmm.
rather. So for me, what I'm excited about is, on a spectrum of innovation, we have totally innovative Jetson AI, the provider's not even involved anymore, compared to the other end of the spectrum where it's just one-on-one therapy moved online. There's very little innovation. For me, I'm most
Mm.
excited about that middle ground where technology is extending the reach of the provider, but the provider is still in the driver's seat. Because at the end of the day, we really heal in relationship. And so for me, that's what I'm most excited about. And it's good to see that now we're beyond general anxiety, moderate, mild solutions. Now there's more personalization in a lot of solutions that are targeting specific conditions and communities. And I'm excited to see those extend those specialized workforces even more.
Yeah, so on that front, I was thinking, I've been thinking a lot about the workforce shortages, right, and how dramatic it is, and also how there's more and more discussion about the role of various types of community health workers in all types of health workforce extension. And I don't know what this like translates to in terms of technology, but it seems like there is definitely a need and a role for more people at the community health worker, promotora, like that level of extension in the workforce. And also, like you just said, we heal in relation to others and in community, and that, really thinking of solutions that bring other community engagement together as well. Like it can't, the solution can't just be, and I'm probably stating the very obvious here, it can't just be more telehealth appointments for people for mental behavior. Like it's more one-on-one telehealth appointments is not solving our behavioral health and mental health crisis, right? There's got to be other solutions out there. What are you seeing in that direction?
I love that you brought that up because, yes, the power of peer support, and there have been, especially Medicaid, there have been models already. And now
Right.
it's exciting to see some companies that are leveraging peers, for example, to as a definition of expanding our workforce. Something that I hear often is, tech can help triage patients to the appropriate level of care.
Right.
And even I've been
Right.
guilty of
Hmm.
saying, okay, we can send mild folks to just self-serve tech tools or peers, and more acute, severe situations to psychiatrists or specialists. But I want to be clear that, peers aren't just like baby therapists. They have their own unique addition and contribution to care. One being that there is a lot of stigma, especially in so many communities that are underserved when it comes to mental health and addiction. But having the ability to connect with a peer from my own community who has walked in my shoes, that could make it that much easier for me to raise my hand and say, yes, this is the first step I want to take into addressing the behavioral health issue that I have that I would not have otherwise. And so, really, there's a lot of opportunity there.
Well, shout out on the veteran side. I mean, that is one of the areas where there's been lots of work around peer support and where there really needs to be, because with every
Hmm.
community, there are specialized things that are only going to be relevant to that community. And talking to someone who doesn't have that lived experience would be probably a little bit like unsuccessful in terms of really getting to the root of what's happening in that person's life and who they're relating to, what their experiences have been, things like that. So same thing, I would imagine you need, and probably there are some great models from the VA and from other veteran and military healthcare.
Absolutely.
Yeah, that company, I've mentioned them before, Even Health. They rely heavily on peer support, and I believe, I may be misstating that they are heavily engaged with the VA as well. So
Mhm.
I strongly believe in that model. I'm here for it.
Right. Yes.
I got something kind of, I don't want to call it controversial, but a little bit spicier now, which is sort of the effect of VC funding in behavioral health tech and what happens when VC funded frothy companies who in behavioral health tech go under. And what it means when someone has a clinical relationship, a support relationship with a therapist or a mental health professional, behavioral health professional, that person is gone from their app. I that feels really dicey to me and really, really concerning. I don't know if you have thoughts about the extra risks and the dangers and the need for maybe a different way of operating in the space.
Hmm. Right. Yeah. I mean, you've seen it from the therapists and providers who are outspoken on social media. And I think it's absolutely warranted that the pressures that the entrepreneurs might be getting to have their
Cut
networks
costs.
work even more hours than is appropriate. And like as I said at the beginning, our provider workforce is burnt out, and if they're going to be
Hmm.
successful in the long term, they can't be burning out their networks and growing that kind of reputation. And so, yeah, going back to what is the lever in scalability, I think it needs to be around tech that can remove all of the barriers that get in the way of providers doing the core things they should be doing, not trying to double down on making providers do even more without stating the
Mm-hmm.
obvious too much. But unfortunately,
Yeah.
that's still the case. So that being said, like AI even being one application of supporting with documentation or tasks that lead to burnout for providers, like that might be one example that I'd implement or look into versus, here are more incentive dollars to see
Mm.
X amount more patients per week. That is well beyond the bounds of what you should be seeing. And then I think
Yeah,
part two
I
of
love
your
it. I love your thoughts on. Oh, sorry. I've got. I live in the South Side. Bad infrastructure. This Wi-Fi situation is bullshit. But no, I was just going to say I love your thoughts on. This should be an extender to the workforce, not a replacement for. Love it.
right.
Yeah. I guess I get a little bit concerned when I think about AI as a solution in behavioral mental health care, because I think, as you said, people really heal in relation to other people. And I don't know that, and that's one of the reasons why I get really concerned about the lack of in-person services as we've moved into a, telehealth moment for a lot of care, in particular, a lot of tech-enabled services are really just telehealth services. And there's something missing there for a lot of people, and it won't meet their needs. And so I worry about any solutions that would rely on AI for more than reducing administrative burden at this point in time, right? I think there is a nearly limitless opportunity for AI and advanced machine learning to reduce administrative burden. Like, I am all here for that, and I wish we would do really just go in all the way on trying to reduce that kind of burden on providers, patients, on everybody else. And so I'm just worried about that being a workforce replacement solution. It's just not, in my opinion. So I don't know if you have any thoughts about that, but I just feel like
Yeah.
people are prone to kind of think of try and find ways to reduce people, right? And that's just not like in behavioral health a really tough one. I think you agree from what you just said, but that's just kind of my worry.
Mm-hmm. Right. Yeah. And for me, and this is just a totally personal anecdote, it's going to be what is the right combination for the person. And so whether it's AI or some other solution, it can't be the only tool in the toolbox. Maybe the most optimal outcome is a piece of that, and whatever's the best that we can personalize to the patient or employee or member. And I think now payers, they have an awareness that if we address the behavioral health issue, these other chronic disease, costly chronic disease issues are also going to decrease. And so they're looking for not just efficiencies for efficiency's sakes, but like what's actually going to work so they can manage the costs. And I know I'm really simplifying that a lot, but I think at the very least that's
Right.
aligned in terms of trying to find something that's going to work for people.
Nice.
Absolutely.
I agree.
Absolutely. Well, Solomé, we are gonna transition off here, but I do want to shout out to one of our loyal followers, Kim Ball, who says, and we have to actually pay peers and community health workers for
Use.
to
Yes.
support solving
Not a volunteer
our
role.
workforce.
Not a volunteer
Yeah.
role.
Yeah,
Absolutely.
weird.
Mhm.
So weird. So weird. Yeah. All the we're funneling 800 million into Olive, but $2 into community health workers. So so thank you. Solomé, any parting words? What would you, I mean, we can't sign up for a conference anymore. It's sold out. So I don't know what your
You can
call to
sign up for the
action is
virtual
here. I
conference,
mean,
right?
come back here.
It's still
But
That's
virtual,
true.
right?
please sign up for virtual as we do every year. It is available for free or make an optional donation of any amount to our
Right.
nonprofit partner this year, Rare Impact
Beautiful.
Fund for Youth Mental Health. So excited to see you all there, and thank you so much for having me.
Yay. Thank you. Awesome.
Awesome. Well,
Good
thank
luck
you.
on the
Thank you. All
conference.
right. We're about to transition. We're going to transition here to special correspondents, Melissa Danino and Nadine Peaver, who just are going to tell us about an event they went to this week, which is Paul Wilder, dude in the upper left, put on the Commonwealth Health Alliance annual summit. And I mean, I don't know if it was a good idea, but he invited several of us out there. I moderated a panel, and Melissa and Nadine were invited. I think it all worked out. Everything was fine. Lisa didn't go to this one. She's doing a Q-Hin panel next week for Sequoia Project. So basically, we're just Q-Hinning all around. So
eHealth
ladies.
Exchange for eHealth Exchange.
Oh,
Not
sorry. I like in my mind they're like this.
Thursday.
Their conference. It's co-located. So I never know.
Co-located conference, exactly.
Oh
All
my
fake
God. Oh my
Q-ins
God.
all
So,
the time, you guys. That's all I gotta say.
all right.
Make it real.
So can you guys? Okay, you guys.
I was gonna
we have
say.
technical difficulty. Oh, Nate, no,
Sorry.
I want you guys to actually introduce yourselves because I don't know how to make the name
Oh.
go on the tile.
Oh, okay. All right. We got this. I am Melissa Danino. I work with Incenna as the Director of Market Access, and that's pretty much all about me. There you go. Gonna pass it over to Nadine so she can
Great.
The best of New Jersey. The best of New Jersey.
That's,
right here.
I love that.
Right here.
I get
She's
that
right
intro
here.
whenever I'm here. I'm right here for you.
Love it. Nadine Beaver joined the Incenna team pretty recently, but I've just kind of been around health tech for a little while here and based in Atlanta.
Yeah,
The
startup
actual
queen
best
over here.
Incenna,
Startup
because
queen.
Kat is like rarely actually in Atlanta. She's the not located in Atlanta.
Yeah.
Nadine, best of Atlanta.
Yeah.
Melissa, best of New Jersey. Kat on a plane.
Best of
I
the
feel
Delta
bad.
I say that
Airlines
to her all the
network.
time. I tell her when I see her in her
Yeah.
office, I feel
All
like
right.
it's weird.
I know it is weird. It's totally weird, but I like it when I'm here. So, all right, you two. We went to Paul's conference. We partied. We learned some things. Just give us the DL. Like, what happened? Was it even worth going?
Yeah, totally.
You know what?
I don't know.
Debated.
I heard a long pause. That's all I'm saying.
I debated actually creating another formula this week for like the conference formula for the but I think there's too many different categories. You can't just create one formula that encompasses all of the conferences. So I think there's a really good sweet spot here. There's a really good sweet spot here that Commonwealth hit is that it's like a pretty intimate group. And so you actually, as opposed to the health and the vibes where I like day 2, I'm like, all right, there's too many DJs, there's too many disco balls. Like I'm like, I need to medicate and get out of here because it's too stressful. But you come to this and it's very manageable. It's other people who are also, they get it, and you can have real conversations, and it's a curated group. I'm a person who we've talked about this. I want to bring everyone along to everything. But what I've learned recently is that there's a lot of value in having a smaller curated group.
Now we're getting some. Oh boy. Okay.
Oh, is
I
there
think it was just Nadine hitting
What are
the
we getting?
desk. I think that's all it was.
Someone needs to mute their something. Oh my God, Kat.
I think Nadine was really excited.
I was just really excited and slamming things here.
Our tech problems today are over the top. Y'all, this is not a professional operation. We're going to try.
Well,
Keep going.
I don't know. When we get our first sponsor, maybe we can make it better. I don't know. But yeah. Anyway, Nadine, keep going. You were talking about some other formula or something, bringing people together. Maybe don't hit your desk this time.
Yes. Okay. So so there's a lot of value in these like smaller, more curated conferences versus this like huge free for all. So I love bringing everyone together. It's kind of my thing. I'm like, oh yeah, community is great. But something I've been honing in on more recently is like being intentional about the people that you bring together. And I think that was really the sweet spot for the Commonwealth Conference or summit fall event.
Fall summit.
Yeah. I don't know.
Really good group of people.
I'm going to chime in here and say that I've said this before. I've gone to a few recent conferences that were a little bit different than the larger health ones. And what they did do was they had a patient's journey panel. And it was actually a woman that owned her own organization, Unit 387, very smart, intelligent woman. But she was talking about her whole entire situation with her daughter and how hard it was for her to collect all of her files and charts and medications, and how she named her organization after Unit 387, which is the room that she was in, but specifically because she was unable to get all of her daughter's documentation, and how hard and how much it like paused her actual health recovery. So I thought that was great. I think it's a nice touch when the summits and the conferences do that and they bring in a patient journey. It makes you really relate and understand what's going on, and it's a more human point. So I thought that was a really good touch point that they did.
Isn't that so weird? I feel like we've been talking a lot of companies that like actually care about patients is like so weird, right, Lisa? It's weird. Like weird. I know, no, so weird.
I think that's a good. I mean, if you're gonna do, like you're saying, if you're gonna do this conference thing, you're not like a massive, like big event like a HIMSS or a health or a Vibe where you're like, we're going to bring together everyone, they're all going to come together at one trade show floor, then you should make it really targeted and engaging. And yeah, ideally you do have somebody who's talking about their actual experience using your technology in real life, making an actual, impact on their health outcomes. That would be good, right?
Yeah,
right.
So weird.
Whatever. Weird.
We also learned, that at least a few, not all, QHINs will be real in December, mid-December. Theoretically, we learned not all. I mean, that's just a rumor, but it's a real one. It's a real truth rumor.
It's a real thing. It's gonna be a real thing.
Yeah. So we don't know what's going to happen there. I got to moderate this panel. I just want to show you guys because I feel like one of these things is not like the other.
Oh my God.
Just putting that up there so everyone can see. But I thought that was cool. But
the real crime there, Kat, the real crime is those chairs. Nobody should have those kinds of. If I'm going to make one edit for any conference, to not have the weird tall chairs. I am short. On a good day, I'm 5'3" at most. That's debatable. And I do not like. My feet wouldn't touch the ground, and then putting them on the little foot rail. That is not.
Like you got to
that is
climb a
bad
tree
look.
to get on it. Yeah,
Don't. Yeah,
It's a little
no
bullshit.
climbing a tree. No, that is like an assault on me. If you put those chairs up and I'm on a panel, I'll be like, I'm walking out. I'd rather stand. I would much rather stand. So,
Well, some people were
just a tip,
standing, and
don't do
I
that.
think, that was
So
smart.
note
I
to
also,
self,
I
we'll
was
make sure
initially,
Paul knows that.
yeah,
No.
we
We'll
got to
tell him.
report back, guys. It was basically our job to tell him those things. But, I also thought, like, okay, to talk about the chairs for one more minute, I was like, this is bullshit. Like, this is sexist because I look amazing and I'm wearing an awesome dress, and I got to like hook my heel in, right, to like
Right.
make it. But then none of the dudes looked comfortable either. So I think it's just bullshit all around. So
It's not comfortable for anyone. Like it can be awkward and like dangerous if you are wearing a dress or a skirt kind of thing, but it's not comfortable even if you're wearing pants. It's not good for anybody. Those are acts on comfort and just like ability to do your no, they're not. They should be banned. I'm calling for a ban on tall chairs for panels for conferences. That's my my campaign message here.
I feel like if they're like too short though, you kind of like sink back in and you're kind of
No.
I
feel like the living room feel, where you're having like a nonchalant conversation. I feel like that's a good look. Like when it's like a nice, like comfortable chair.
I like a table that's like skirted so you can like not be worried about what your weird legs look like, and like it's going to be focused on your presentation and like like just like a barrier of sorts. Big fan of that.
I feel like your heel should be a focal point.
I love all these like we have a lot of like really strong opinions on chairs here.
About the chair.
Yeah. But listen, other things happened at this thing, right? I mean, other things happened. Like, so you both met really interesting companies, Saving America. You each get to tell us about one interesting company that saved America at Paul's conference.
Nice.
Okay. I was a big fan of the team at Solace, Jeremy at Solace, really great guy. Although my big takeaway was that I wanted, like, my boyfriend and I are going to go vacation with him and his wife because I absolutely adore them. But the work that they're doing in care coordination is going to be awesome. It's great. But yeah, really, really, I feel like these conferences, it's always a big reunion of just people, really good people.
Yeah, Jeremy at Solace, he was a cool dude. He also had good vibes, and I feel like he's saving America a little bit. Also, I was talking to a founder today, same kind of situation. Many of them have such personal ties to the work they're doing, right? He had a caregiver issue, home care type situation problems, and like I just love it when people are like, you know what, I'm gonna fucking start a company and fix that shit. Like I'm into it. So like that guy, we should have that guy in the show. Lisa, you'd like that guy. Melissa,
yeah. I just want to know, we actually have some, again, I can read comments now amazingly on the app. It's incredible.
Oh, I can't.
We have two amazing comments. So Kim again mentions, she's talking about a book called The Art of Gathering by Priya Parker, which she hasn't read yet, but she says one of the summaries is we over-include because we don't know why we're gathering, which is a great just like point to say like, what are you doing this conference or whatever for? And then we also had another vote for skirted tables. So I'm going to go with that one as like the winning vote for how to do a conference panel. Thank you for confirming my opinion.
And Emma, you are welcome. You are welcome for me repping the ladies on that all-male panel. Anyway, all right, Melissa, you go.
Man.
I'm going to go back to Unit 387. I was literally on her pretty much the entire time, learning about her company and her organization and her daughter's story. And I was really compelled to really get to know her. So super amazing things that they're doing. She's been growing exponentially, and she sits on one of the committees for Commonwealth as well. So Unit 387, Meredith Manick.
Well, we might have to have her on the TV show too. I don't know. Okay, you guys, we're almost out of time. Lisa and I still have to banter. I'm sending you away. Thank you for your service to health tech conferences.
Thank you for your service.
Jeanette Nelson, the conference, Solome's conference is called Behavioral Health Tech. You can find it by Googling Behavioral Health Tech Conference. And I think it's under you'll see it there. But again, it's
we're
free.
We're gonna put it in the wrap up. Follow our page. We'll put it in the wrap up as well.
Follow our page.
follow our page, right? Like, follow,
All right.
follow,
Oh
and
my
attend the
God.
previous next session. So we have a maybe announcement. We're going to probably finalize it soon. Again, we don't do a lot of prep work or like planning, but we are going to be holding next week's Health Tech Talk Show on a Saturday. I know, mind blown.
Friday
We're
on
gonna
a
do it, though.
Saturday.
Friday on a Saturday. Don't think about it too much. It's going to be amazing. Definitely join us. We're going to have probably some really amazing guests. We'll probably be even more organized than we were today, which is to say, not at all. That's the most exciting news to say.
I'm sure.
Not
I'm
sure.
sure. I'm sure.
We
It's
don't
amazing.
know.
Also, Lisa, should we tell everyone about our very exciting announcement about the thing that we're excited about? Or should we do that
Yeah,
later?
totally. No, go for it.
Yeah.
You got
You
1
guys,
minute.
the Health Tech Talk Show. The Health Tech Talk Show is going to be like broadcasting live at Vive.
We think. Possibly. We're pretty sure.
Well, we don't really know how to do it yet, but we're going to figure it out. We're going to figure it out.
85% sure at this point. We will be there at Vive. We will likely be trying to broadcast. And so we are very excited to hopefully see you there, or you can watch us trying to navigate the Vive show floor. We'll see. More to come. February,
Yep,
Los Angeles.
Yep. God bless America.
That's
well,
it.
all right. Okay. All right. Thank you, everyone. Thank you to all of our loyal followers for watching us again and dealing with all of our issues.
For dealing
God bless
with
our veterans.
Years. Glad they finally fixed that for you. Hopefully, fingers crossed. Please stay safe. Bye.
God bless America. Oh, so fun.